Hello and welcome back to Culture and Health, your go-to channel for the latest in culture, news, and all things health-related, powered by OpenAI's ChatGPT 4o. I'm Regina, and today we're diving into a global issue that's got everyone talking, a new disease outbreak in China that's raising serious alarm. If this feels like déjà vu, you're not alone. Stick around because we're breaking down what's happening, why it matters, and the lessons we must learn to avoid repeating history. Let's jump right in. Here's what we know. China is facing a health crisis that feels eerily similar to the early days of 2020. Hospitals are reportedly overflowing, with thousands of patients experiencing severe flu-like symptoms. Officially, Beijing has labelled this outbreak as a pneumonia of unknown origin, but experts believe it's actually linked to a known virus. Human metapneumovirus, or HMPV. HMPV isn't new. It was first identified over 60 years ago and it's fairly common. However, the scale of this outbreak is unprecedented and that's what's causing concern. Multiple regions in China, including Beijing, Tianjin and Inner Mongolia, are reporting surges in cases. While these areas appear to be the hardest hit, the lack of transparency from Beijing makes it difficult to determine just how widespread the outbreak really is. Accurate case counts and data sharing are crucial during health emergencies, yet they remain a significant challenge. Let's look at the affected population. HMPV primarily impacts children and adolescents, who are the most vulnerable. Right now, a significant number of reported cases involve children. The symptoms, fever, cough, and difficulty breathing might sound familiar. In severe cases, HMPV can lead to complications like bronchitis or pneumonia, often requiring intensive care or ventilators. This scenario is hauntingly similar to the early days of the Wuhan virus. While HMPV is not new, this large-scale outbreak is straining China's healthcare system. Reports indicate overcrowded hospitals with resources like oxygen and ventilators running low. Despite these challenges, the Chinese government has downplayed the situation. Transparency is key in managing global health crises, yet Beijing has consistently withheld critical data. The World Health Organization, WHO, has repeatedly urged China to provide accurate data, not only on this outbreak, but also on past pandemics. Unfortunately, Beijing continues to respond with deflection, claiming their transparency exceeds expectations. But let's be real, actions speak louder than words. In 2023, WHO officials criticized China's lack of cooperation, calling it inexcusable. This contrasted sharply with the initial praise China received in early 2020 for its pandemic response, a response that led to global disruption. So why is this outbreak such a big deal? The lack of transparency delays global responses, giving the virus more time to spread unchecked. We've seen the consequences before: overwhelmed hospitals, oxygen shortages, and families unable to find care for loved ones. While HMPV isn't as severe as the Wuhan virus, the potential to overwhelm healthcare systems remains serious if the spread escalates. Now, let's talk solutions. What can the world do to prevent another global crisis? Vigilance is essential. Health organizations and governments must demand transparency and act proactively. Relying on China's assurances without independent verification is a mistake we can't afford. The stakes are too high, particularly in densely populated areas. Additionally, international cooperation is critical. Sharing resources, research, and real-time data can make a difference in containing outbreaks like this one. Public awareness is another key factor. Keeping people informed ensures they understand the importance of precautionary measures and vaccinations. At the end of the day, health crises remind us how interconnected we all are. Viruses don't recognize borders or political divides. They're global issues requiring unified responses. Transparency, honesty, and collaboration are the tools we need to tackle outbreaks like this and build resilient healthcare systems for the future. That's a wrap on today's episode of Culture and Health. Thanks for sticking with me as we explored this critical global issue. If you found this episode helpful, be sure to like, subscribe, and hit the bell icon for updates. Let me know your thoughts in the comments. What lessons do you think the world still needs to learn when it comes to health crises? As always, stay safe, stay curious, and take care. Until next time, this is Regina signing off.